Namaste, Vanakkam, Swagatam, Bonjour, Buongiorno, Buonasera, Buonanotte, Kuyamure, Boreka, Kia ora, Salamat Pagi, Ayu Bovan, Ayushman Baba, Shubdinam, Suprabhat, welcoming everyone logging in from all over the globe for this second day of our international webinar series on salutogenesis and holistic health. Let us begin with a prayer. Sahana bhavatu, sahano bhunaktu, sahaviryam karvavahai, tejasvinavaditamastu, ma vidvishavahai. Om Shanti Shanti Shanti. Om Shri Gurubhyo Namaha. Hari Om. We are here celebrating the centenary year of Aaron Antonovsky, the father of salutogenesis, and it gives us great pleasure at the Institute of Salutogenesis and Complementary Medicine, having a school of yoga therapy and a school of music therapy, to host this international webinar series in collaboration with the Indian Yoga Association Puducherry chapter. We began last week on the 9th of March and continue to the 27th of April. We would like to offer this webinar as a dedication to the father of salutogenesis, Professor Aaron Antonovsky, in his centenary year. And last week, the event was inaugurated by our respected Vice Chancellor of SBV, Professor N.R. Vishwas, sir. And in that first day, we had an amazing presentation by Dr. Avishai Antonovsky, the son of Aaron Antonovsky himself. And following that, we had a session by myself on Swasthya and Adi Vyadi. And today, our second day of this program, we have Professor Dr. Sobana Jai Ganesh, the Administrative In Charge, School of Music Therapy, ISCM Sri Balaji Vidyapeeth, who will be the first speaker for today. We welcome you, ma'am. And we have her talking about promoting salutogenic capacity and health professionals, salutogenesis in hospitals and primary care setting. Following which, we'll have another presentation by Professor Dr. Meena Ramanathan, the Vice Principal, School of Yoga Therapy, ISCM. We welcome you, Dr. Meena, also to this day, who will be exploring Ashtanga Yoga of Maharishi Patanjali, Pancha Kosha as a model of holistic wellness, and an important concept of Swami Geetananda Ji, Nara the Psychic Disassociation. Coming to our first speaker today, we have with us Professor Dr. Sobana, who is the Admin in Charge, School of Music Therapy, ISCM. She is also a Professor of Physiology and Deputy Director of the Medical Simulation Center in Mahatma Gandhi Medical College and Research Institute. She has an MD in Physiology as well as a PhD in Physiology, and has completed a PG diploma in Music Therapy with also fellowships completed in Medical Simulation. She is a gold medalist in both the MD studies and her PG diploma in Music Therapy. It is a great honor that she has been associated with the School of Music Therapy since its inception as an adjunct faculty, where she was involved from the days it was still the Center for Music Therapy, CIMTER. She has done extensive research on the role of music therapy in students' wellness and in clinical settings, and published 30 articles in peer-reviewed journals. She has a copyright submitted in the name of SBV. All our copyrights, today we got the news of the 23rd copyright for ISCM team. And ma'am has contributed the one for the meets, the musically express your emotions and thoughts for success. With this brief introduction, I give over the stage to Dr. Sobana, who will be taking us forward on this topic. Welcome, ma'am. Looking forward to listening to you.
Good morning to all. Namaste, sir. Am I audible and is my slide clearly visible to all?
Yes, yes, ma'am. Perfect.
Yes, sir. Thank you, sir. I'm really humbled and moved for this opportunity to talk in this platform with a group of people who are focused on the wellness of everybody and on themselves. And also to follow or to be given a chance to talk after the great legend's son, Avishai Antonovsky, and our most dear director, Professor Ananda Balayogi, sir. So it's really one very important day in my life. So I'm really thankful. And I feel why I am chosen to talk this particular topic. People here know me, and for a few whom I'm new, maybe I'm a person in the hospital setting and also a professor in the medical college and involved with the ISCM and the School of Music Therapy over a decade. You would have chosen me to bridge between the college, the hospital, and ISCM. It's really a privilege and a honor, and I would do justification for that. So coming to today's topic, I am asked to talk about salutogenesis in hospital and primary care setting. A very new topic for all of us here. So let's have a common discussion on the topic. And we also look at how to build a salutogenic capacity for health professionals. Yes. When I looked at the healthcare system now, which is present, I could see the healthcare as the tip of the iceberg. Everywhere throughout the world, healthcare is given as a curative one for people who suffer, or of course palliative when treatment is not possible. We look only here, but look down how much is immersed under the sea or under the ocean, which is not being taken care at all. When I just looked around myself, what was not taken care, I found that amongst all of us, be the faculties or the medical professionals, are really stressed and are burnout. Aren't we? I am sure my colleagues would accept that. So we don't look at the well-being or we don't look at the faculty burnout. That is one part of the ice which is under the ocean. Then we keep on loading and teaching or capability enhancement, skill enhancement, go do your electives, do this, do your research, loading our students. So, but we don't look at how they feel, how much they are able to take in. So the students' wellness is also merged under the ocean. This also, I think everybody here would accept. Third, we look at patients as a patient, as an object, as a case. So medicine ward, 12th number bed, we prefer them like that. Yes, we have developed. We have developed dialysis. We have developed liver transplant. We have developed oncology, so much. But did we look at what that person in the 12th number bed in first floor medicine wall feel undergoing all these things? No, not many of us. We didn't have the time, we didn't have the initiative, whatever it is, to look at really how the patient in 12th number bed felt. So when I was looking around myself, I saw this tip was taken care and everything is merged beneath. Let us see who digged it out, what came out of everything buried under. Yes. The topic also includes to promote salutogenic capacity. So to whom should I promote the capacity, or whom should all of us aim to build the capacity? To our stressed student, aren't we? Yes. To the burnt out doctors? Yes. To the scared patients? Yes. So let's see how we are now and what initiative we can take, or what initiative the world around us has taken, where we stand in this to build a salutogenic capacity. Before we start, we should really salute to our institution, which is a pioneer in looking at this angle of healthcare. Sri Balaji Vidyapeeth with visionaries have looked at building salutogenesis, salutogenic capacity for health professionals as a whole, so that they have dedicated an entire center as the Institute of Salutogenesis and Complementary Medicine. Here we are, as our director said yesterday, the 10 of us, the Dasavadaram, who hold the torch far ahead of the entire globe, leading towards salutogenesis. So in the entire institution, we are here, the I block, the first floor, the Institute of Salutogenesis, marching towards wellness to all. So when did this salutogenesis emerge at all? Is it something new only last year or 5 years back? When did it actually emerge? Maybe we started hearing the word from our most respected Professor K.R. Sethuraman sir, who brought in the term salutogenesis to us. But the whole world, when at all the word emerged? When I looked at the literature, it was half a century before, that is in 1986 itself, the WHO, or the World Health Organization, has felt that there needs to be a change in the orientation of health services. But none of us knew what we are going to do or what to do. And in 1996, our father of salutogenesis, Aaron Antonovsky, he put forth the term salutogenesis, and he said, we need a paradigm shift, a total shift of what we look at, or what the Western medical thinking looks at, from looking at pathogenesis to wellness or salutogenesis. So he was a visionary. Before 20th century, in 19th century itself, the father of salutogenesis has given us the term salutogenesis. So all of us at this year, today, in his centenary year, salute you, sir, for your great vision and for making the path for all of us to follow. ISCM had the privilege to unveil his photograph in the entrance of our center. And here you can see his photograph. And more so, it was unveiled by his own son, Aaron Antonovsky. So we are proud. We will tell it numerable times today and the days to come. And when I was given the topic to talk, and one day Professor Ananda called me and said, Madam, why don't you take this topic? I was like looking, what am I to talk? Because hospital, they treat patients, they treat diseases. Salutogenesis is limited to our ISCM. Okay? So in the hospital, salutogenesis, what will I talk? Then he recommended me the handbook of salutogenesis, and to mention, it was referred to by our most beloved Professor K.R. Seturaman sir. And this book is the Bible or the Quran or the Bhagavad Gita of salutogenesis. And he has given a complete encyclopedia of salutogenesis. One chapter needs to be read more than 10 times to understand what he wants to convey to the world. So I'm really very privileged to have been given this book to read at all, which opened different closed doors in myself about health and wellness and patience. Myself, from 1985, around 15 to 35 years of completing my medicine, I have looked at patients. Maybe even I would have looked at patient as a patient. No, when I was doing my practice, I will ask my staff, எவ்வளோ case உட்கார்ந்துட்டு இருக்கு? It is not உட்கார்ந்துட்டு இருக்காங்க also. Because my lunch time would be nearing, I want to go home, or my daughters are small, they would have come from school. So I will ask my sister, எவ்வளோ case உட்கார்ந்துட்டு இருக்கு? So to myself also, there is a total change in my outlook as what a healthcare professional is really bound to do to the world. Yes, it's not only to the world, as a healthcare professional or as a human being, what you are bound to do to your fellow being, what you are bound to do to yourself. So here comes building in salutogenic capacity. Let's see, as I told you, to these three group of people, how are we going to do this? Let's look 360-degree around us and let's see the possible ways, let's see the challenges and so on. Now, I have a disclaimer to the audience that almost maximum of my presentation are from the book of Salutogenesis by Aaron Antonovsky. And also, sorry if I repeat few concepts because they are not lists, they are a process. So one may precede other, one may follow the other, certain things are repeated. So bear with me if I do so. And next, I would also wish to share few of the initiatives which are being done by the Institute of Salutogenesis, which comprises of the School of Yoga Therapy and the School of Music Therapy. I think the introduction was quite long because I wanted to share all this before we actually talk. And it's a real sensitive issue. It includes a lot of management policies. It includes a lot of spiritualities. It includes a lot of introspection to think of this topic. So let's see what we have and let's talk or discuss among ourselves about all these facts. So to promote salutogenic capacity to health professionals, we should first understand presently what is the situation. Okay, so we just saw the tip of the iceberg. That is the present situation now, but for a very few places where we look only at diseases and almost we look at palliative care. But palliative care, when does it start? When there is nothing else to the patient, isn't it? When you don't have anything, you just give him well-being. That is how it is now. So first, let's see how the present scenario is. What are the challenges when you have to adopt salutogenesis? Now, when you change the orientation to salutogenesis, how do you construct it? What are its implications? How do you construct salutogenesis for healthcare professionals? Let's also talk about the role of the sense of coherence in healthcare. A very amazing concept which was put forth by our father of salutogenesis. Finally, we'll also compare salutogenesis with rehabilitation or salutogenesis with palliative care. Because so long even I was thinking palliative care or rehabilitation or health care, health promotion is salutogenesis. Most of us will have our own thinking. So let's see how it actually differs. So in the next 30 minutes, we are going to talk about all these things. Few things may repeat, few things might be known to you already, few things you might be practicing in your day-to-day life. Well, you're most welcome to interrupt in the middle and share your thoughts if any. So shall we go into each one? Okay. Yes. We saw currently how the healthcare system works. Now, we know it looks only at the tip and so many things are submerged. In order to look at the elements which are submerged, there are lots of challenges or hurdles which we need to cross. When I looked at the surrounding healthcare system, few challenges I could feel are the policies of health governing bodies. They normally look at list of diseases, how it happens, how do we prevent diseases. So the healthcare policies, you might have heard so many policies by the government of India, anemia prevention policy, malnutrition prevention. So many are there. So the policies themselves look at different angle. That is a challenge. And these policies look at a person who is deceased and a person who is healthy as two separate entities, as two compartments. And for everything, we need an evidence-based to follow. Knowing these challenges, how or what are the strategies which are put forth by the literature to overcome them? Yes, the solution is completely changing the orientation. You just turn around and take another path and walk. So restrict your pathogenic orientation to healthcare practices. It is practices, the research and policies, everything. Restrict them, take a U-turn and take up the salutogenic orientation in your everyday practice. Make it as your everyday practice and research. So that would be the solution, taking a U-turn. But is it possible, like 180-degree turn, suddenly walk the other way? We know it is mandatory, but how to take that 180 turn? You need to move 10 degrees slowly to take the U-turn. Yes, when so many people will drive your car, so you're going in two lane, can you take a U-turn? And especially our Pondicherry traffic doesn't have different lanes at all. So taking a U-turn is not an easy job. It needs to look around, see what is there by your side, and then only you can take that U-turn. Yes. So the present healthcare system, as I spoke, is disease-oriented, whereas the salutogenic pathway is wellness-oriented, evidence-based. So we said that we need to take an U-turn from the pathological orientation exactly to the salutogenic orientation. So each 10 degrees, what are there? There are few existing practices. We can't say the existing practices are totally wrong, completely stop everything, do a new. No, it's not like that. Modify the existing practices, either directly or indirectly. This is a very generic term. is to be done for each particular unit or specialty or department, how they modify the existing protocol. An institution has to change its policy itself. They have to guide the interventions, the healthcare interventions. And more than anything else, the institution and the policy should look at work-life balance of their staff. So changing the policy, changing healthcare intervention, and looking at your staff. Are they balanced in their work life? All these need to be done stepwise so that you reach the peak of salutogenesis. Yes. Before I go to the various orientation, is there anything from the audience who would like to share here? I'm most welcome for that. Anything what you had experienced or now you feel like this could have been done, or you have anything controversial to what I told, I would be happy if I get from the audience, or those who are just muted, I want to wake them up. Yes. Are you awake, everyone?
All are awake, ma'am. All are awake. Please continue.
Yes. Any controversies in these concepts which we discussed now? Dr. Rama Reddy, sir, you had been in practice for a few decades. What do you feel, sir? Because I am talking for a long time. Yes, sir. Can you unmute yourself?
As a practitioner, what we feel is offering the cure or offering some remedy is more rewarding rather than going for the salutogenesis part, because salutogenesis is not quantifiable or cannot be experienced immediately by the patient and party. So we are all tuned to pathogenesis model, offering some reward. So salutogenesis is a very good thing, ideal thing, but practically may not be monetarily and praiseworthy rewarding. So we have been a bit withholding all these days.
Sure, sir. I totally accept your words. But when you think of yourself, do you feel that the salutogenic capacity of a health professional is very important and need to be taken care of? Unmute yourself, sir. We can't hear you.
Yeah, definitely, madam. Because from health professionals' point of view and students' point of view, because it is a really worth investing, rather than the number of patients we get with the limited number of health professionals and students. Salutogenesis application there will be really rewarding. That can be applied also easily because they can understand and they can follow, and we can monitor also.
Yes, sir. Anybody would like to give your views about the faculty and staff, about their wellness and salutogenic capacity? How much important does that need in the present scenario? From my colleagues, Dr. Balaji and Dayanidhi, are you here?
Yes, ma'am, we are here. We are going.
Yes. Okay. So, when we all agree that the salutogenesis of healthcare professionals, of students, of patients, everything is more important. Let us see how we are going to do that. Can you minimize? Just give me a moment. Okay. Yes. In order to promote salutogenic capacity, we need few orientations or few forms. We call it as the salutogenic orientation or looking at wellness. And we have to look at how the sense of coherence influence in this building of salutogenic orientation. And by this orientation, a different healthcare model or a salutogenic model has to be developed. What is a salutogenic model and how do we reach the model, or how do we really build the model is $1 million question now. So there are orientation and a path which leads to developing the model. Yes. Salutogenic orientation or thinking in the salutogenic way has 3 basic assumptions. You understand few things to get yourself oriented in the salutogenic pathway. One is, we have to understand that human body starts decaying or apoptosis happens right from a child is born. See, our hair gets grayed, you develop cataract, your skin wrinkles, no? Muscles become weak, bone become osteoporotic. So aging and apoptosis is a continuous process. A human body is not like a computer, 100% it is good, then it becomes damaged. No, there is a apoptosis or slow decay and regeneration of cell happening from the day 1 of your birth. You cannot escape or you cannot come out of it. Only thing you can modify it. So basically understand that human system is flawed by itself. And the disease wellness model or disease and wellness are not 2 separate entities. They are a continuous model. So you cannot separate a person with disease from a healthy person. Have that in mind. And Antonovsky says, build salutary factors. Salutary factors are in his verbatim factors which are negenotropic. That means they actively promote health rather than those factors just which low risk. Okay, so we have to look at all these 3 when we start orienting ourselves to salutogenesis. For the U-turn, okay, just remember we are going to take U-turn now. Our car is looking around to take. So look around oneself, understand the system is flawed and it is a diseased model, and you are supposed to build salutary factors. Have that in mind when you take the U-turn. Yes. So you take a U-turn. For what do you take a U-turn? You take U-turn or you take the salutogenic orientation for the health and wellness. Agreed? For whom? Again, as I told, for the hospital staff, for health professional education students, and the patients. Okay. So Antonovsky says you have to encompass all person, encompass all aspects of a person, independent, healthy, or diseased. So I had read this so many times because each time I read, it gives me different meaning. It gives me in-depth meaning. So to get oriented, you need to look at everyone around you, including yourself. Don't forget that. And look at all aspects of the person, independent, or he might be healthy or diseased. So now my car is ready for the slow turn. Nobody is around. There is no two-wheeler trying to overtake me in the wrong side. No, there is no auto suddenly coming from the crossroad, or there is no dogs crossing me. So I'm almost okay for the turn. Yes. So, I'm sorry. I have taken the turn. How can this model help us to build our healthcare system? You need to change the policy of the healthcare system. You need to change the clinical outlook of the stakeholders involved, and you need to widen your diagnostic and therapeutic repertoire. So, the list may be long, but it is also the same which we have been talking this 15 minutes before. I really looked at, I should not repeat things, but it keeps coming because each are related to one another. Again, now we are in the third stage. We have changed our orientation. Now we are going to build a model. Okay, you're going to make a foundation for the healthcare system. What are those pillars in your foundation? Or what are those pillars in your big castle? One is your leaders and your staff must be educated in salutogenic policy. Your students must be integrated to develop salutogenic capacity in all their stages. The faculty and students must learn to self-tune and reflect on themselves so that they know their strengths and weaknesses, so that they use their strength to develop their, to overcome their weakness. So teach them to self-tune and reflect. Also, by all these, empower and provide wellness to your patients. Again, this is my first slide where we saw the tip of iceberg and what is buried below. So each element we are supposed to address when you build your castle of healthcare, which looks at salutogenesis. Yes, I have all the budget ready. Our administration, the management, no, the finance has given me everything. Now, how am I going to build my castle? I dream of building a castle. I know this. I have made a blueprint. I have made a plan. Yes. So how am I going to do that really? First, you need to educate your students because they are the backbone. I would say that I have been seeing students for around 20 or 15 years. Students of all years are put into so much of pressure and stress. And many of them are not able to take it, and they really struggle to overcome. They have the capacity to do it, but they need a holding hand or someone to guide them through the hard times. We are supposed to do it as teachers or healthcare professionals to guide and lead the students. So integrate the principles in health professional education in all the year. I have seen students who had been topper or rank holders who could not even clear their year one examinations. So where is the problem? The student is capable, so he is struggling to cross the bridge, and it is our responsibility to hold a hand, help him cross the bridge. So we need to integrate the principle in education. We need to develop their personality, not just reading, mugging up, doing their examination. For a Viva, a student would know everything, but his inhibition to communicate or express will stop him from answering. So you need to develop his communication skills. You need to develop his way of expression, isn't it? So you need to develop the student as a whole. So here I thought this topic includes a lot of management strategies also. Do you agree? Yeah. And don't focus only on what to do, and also focus on how to do when you teach your students. And a teacher has to do by teaching, has to teach by doing, not just teach by telling. As I told earlier, Teach your students the self-tuning model for introspection and a reflection. Now I see that apart from management and healthcare, we have now entered into the domain of medical education. This is a very, very new perspective, which I understood after preparing myself for this talk. So long, the medical education or health professional education, which had been looking into all skill development of a student, I'm not sure or I'm not aware, did not look at the personality development, did not look at self-tuning, did not look at introducing salutogenesis or enhancing the salutogenic capacity of a health professional student. I think it is our responsibility in the unit of salutogenesis to take this message to medical education. This is a very new path break in our own travel, I felt. So we need to educate our health professional students who are the doctors of tomorrow. Then, yeah, I am very proud to mention here that we have already taken this initiative from the Institution of Salutogenesis and Complementary Medicine, supported by the administration of Sri Balaji Vidyapeeth. The Center for Yoga Therapy is first to introduce yoga in the curriculum of health professional education students. I could see our nursing students coming and doing yoga here, our allied health science students doing yoga, the MBBS students doing it on the floor, and I could see Danush and Charu shouting with a whole lot of them. No, there will be yoga mats everywhere, and it will be a very nice sight for me to see the students doing. They really enjoy when they do it, because for them, no, daily it is PowerPoint presentation, list of diseases, list of bacteria. Sometime you are left without everything. You just do something for yourself. And I have seen them enjoying that. So it's a pride for us that we have introduced yoga in the curriculum, first ever in India, I should say. Am I right, sir? Yes. Yes. So next is my own copyright. It is not my own, by the team of Center for Music Therapy. Meets goes as musically express your emotions and thoughts for success. It's a kind of, and always don't relate yoga and music to relaxation or stress relief. It is a part, yes, I would agree, but it is not only for that. When they involve themselves actively in musical activity, when they do lyric lighting, when they participate, when they sing along, when they do the drum cycle, they overcome their inhibition. They are able to express, they are able to move along with their peers, which will help them later to move along with a patient, with a senior clinician. So this meets program is being done since 2016 or 17, I believe, around 5 or more years. It has been done as a part of orientation for all the health professional education students in SPV. The medical, nurse, dental students do it. And we also have sessions for our faculty and staff, both the yoga and musical sessions. The yoga session to improve their physical and mental wellness, and the music therapy session for them to overcome their burnout and for them to come down to their normal level. So promoting student and faculty wellness, which is the major part of building salutogenic capacity, is being done by ISCM for more than years together. And we have so much of research done in that and so much of positive feedback. And I would like to share personally, the medical students who come here or the nursing students, when they leave, they will definitely tell us, ma'am, when will we come here next? They will ask me, we want more classes like this. And normally we have our students, 250 students divided into 50-50 each, and each 50 go to different activities. So in the college corridor, when we divide the students and take 150 students, maybe 1 to 50, go to I block, they will just shout, hey, I'm going to I block, because they are so happy that they come here. I have seen that in the students. And this ISCM floor, as our director has once told me, is a place where a student can come and they have a place to vent out or share themselves. There is even now we need someone to talk about our challenges or difficulties or some hurdles I face. I need someone to talk. They need not even tell me a solution. There are some lendicas who just hear me telling. No, I'm sure that everybody here would need such a place and a person once in a while. ISCM, or the Institute of Salutogenesis, for that purpose, the music and yoga therapy unit are that place which give really solace, solution, and a place where someone can express themselves, share themselves, and they know they will get a solution. They know there is a person to hear them. That is what is needed, where you give the salutogenic capacity to people around you. So we are very proud and we are really happy that we have that opportunity and the capability to do that for our students. So where do we stand? We were looking at salutogenic orientation. We were looking at developing salutogenic model. In the salutogenic model, we are looking at salutogenic model for our students, because I should not lose track. And in the salutogenic model of health professional education, I was proudly talking about myself and our team. So, yes. Finally, we come to the sense of coherence, which is very important for developing salutogenic capability. You must be knowing this. Sense of coherence is every student, staff, and patient should know that what is expected from them or their task is manageable, meaningful, and they can comprehend it. So when I have a sense of coherence, I should be able to make socially valued decisions. I should have a balance between my overload and underload, or my work life. I should be able to work consistently, even when I am overloaded or underloaded. So I should build myself, my capabilities, so that I am able to handle all. My life has some meaning, not just coming, looking at 10 patients, writing the worksheet. That doesn't give you a meaningful, manageable, comprehensive life. So building an SOC is making a person feel they are wanted, feel they are meaningful. So how does an institute help this? The institute should support, and the institute or the leader should set a role for everybody which is comprehensive, meaningful, and manageable. Measure and screen periodically. A person's SOC cannot be radically changed, but you can manipulate it or you can modify it. So that is the role of an organization. So they have postulated talk therapy is what we talk, the counseling and all those things. Now, finally, before I finish, there are just two very simple concepts. Salutogenesis for rehabilitation is presently, rehabilitation is regaining the lost health, but we need to integrate salutogenesis initially during therapy, because salutogenesis not only modulates the outcome, it also modulates the process. So that is where we are. We look at the wellness of patients who are in critical illness like dialysis. We do a lot for palliative care, and which are very good initiatives of ISCM, the music therapy and yoga therapy practices in hospitals. And finally, before I close, salutogenesis are little modified with different age groups. For example, a geriatric person has physical, mental challenges and they need more of coping, whereas an adolescent is in a phase of transition who needs more of support. So with this, here I would like to mention and fondly remember and give our gratitude to the two great icons, as I had been mentioning, Professor K.R. Sethuraman sir, who had sowed the seed of salutogenesis in SBV and who always is supportive and behind us, and our most respected Professor Ananthakrishnan sir, who is a very, very strict master behind us. So who keeps us target, who supports us behind with a yardstick, and he sets us something. When we strive to do it, we really feel, oh, we have done, and ISCM grows a bit higher to the next step. So both of them are always behind us, and our team of Dasavadaras, everybody is supportive to each other in each and every step. I'm really privileged and happy to be a part of this. And I'm also really thankful that this platform is given to me, because it made me understand a lot of myself. And I'm totally myself now. So thanks a lot for that. So with this, I would like to finish my discussion. So any queries, anything, we are very happy. All of us can talk about that. Thank you.
Thank you so much, Dr. Sobana ma'am, for a very lucid presentation where you have highlighted the necessity of salutogenesis in a hospital environment and for all those who are part of that environment, especially from the angle of the doctors, the teaching, the non-teaching, the students. A very beautiful presentation that highlighted and gave a lot of order for thought, and also adding in the work being done here actively with our students, with our faculty members. And your statement is so true that the ISCM, we want to be a safe space, a loving space where people can come and be themselves. And if they have to recover, they can recover. If they want to become a better version of themselves, they can become that. And giving them a supportive environment is one of the main goals of ISCM. Thank you for highlighting that. If there are any questions, we have 6 or 7 minutes that can be taken. You just have to put your hand up and I'll help you unmute, as I've put the setting on mute today. 1 second. Yes. Professor Ingen Hagen. Yes. Namaste, Ingen.
First, I want to say thank you for a very enlightening talk.
You're welcome.
I wanted to say that I really welcomed that you made it so clear that in order to create a salutogenetic environment for patients, it's very important also that the health professionals and also students are allowed to have this kind of, yes, that there need to be a salutogenetic environment for them too, because in many countries, including my own country, Norway, health professionals, medical doctors, psychologists, others are super stressed. They work too many hours. There is no work-life balance. And especially in these professions, for students, they are very competitive to enter, very exam-oriented. It's not environments where it's easy to live a good life for health professionals. For students, it's very fear-inducing. It's not an environment to flourish. So then to speak about salutogenesis for patients and to create, you know, very healthy environments where people can heal. It's very difficult if you have health professionals who don't live, don't practice what they speak, and for students who see this as just another topic to be tested in. So it's very important that health professionals and students are taught that let's create environments where we can flourish, and then we can build similar environments for patients. Yes, thank you.
Thank you. Yeah, you're absolutely correct.
Thank you for that sharing. I think it is a collective effort that if the health provider is not healthy, they cannot give proper health to the health seeker. So the health, and then the caretaker also needs to be healthy. So the care seeker, the care provider, the caretaker, we need to look at multiple dimensions. Such a beautiful perspective.
Yes.
So I wish to thank Dr. Sobana for that very lucid presentation and the nice comments from Professor Ingan also. We are going to end, of course, earlier the beautiful statements from our Dr. Rama Reddy sir also, who's always part of the family and adding in. We value our ISCM community very strongly. We are going to be now going over to the second presentation of the day. So you had a presentation from Professor Sobana ma'am, who is in charge of our music therapy. And now you get a presentation from Dr. Meena, who is in charge of the yoga therapy side. So, you know, you're getting both the wings of the ISCM bird today. And before we go ahead, I just like to point out that just this morning, we received a copyright detail from Government of India, which is for something we submitted last year, but ends up as ISCM's first official copyright, promoting wellness through focus on salutogenesis and SBV best practice. So when we talk about policy decisions, I think this policy and best practice of the university itself deserves recognition, and I wanted to share with all of you this good news. Coming back to today's second talk, Yoga Tilagam Professor Meena Ramanathan is basically the heart of yoga therapy when it comes to SBV, and has been here right from the inception of SITER. In those days, it was SITER. And today, for the School of Yoga Therapy, she is the vice principal. She has been a student and a teacher, a mentor of Rishi Culture Ashtanga Yoga, is a PhD guide and a recognized IAYT certified yoga therapist. She is currently Joint Secretary of the Puducherry chapter of the Indian Yoga Association. She is a lead examiner for the YCB. She is a subject matter expert and task force member for the CSIR, Traditional Knowledge Digital Library project of the Government of India, a very important project to document the traditional knowledge systems of our country. She is also the co-editor of the Journal for Applied Yoga Sciences that is coming out from Loyola Marymount University, a member of the Para Yogasana Sport Promotion Committee of NYSF. She has close to 80 scientific papers, abstracts, 6 chapters in books, and 10 copyrights and 15 compilations. She has done a lot of work in translating a major part of our teachings in Tamil also. And I would always highlight her special interest in Divyanga, the children with disabilities, the silver yoga for the senior citizens and the transgender population. She was most recently awarded a Lifetime Achievement Award, which she received from Dr. B. Ramaswamy, the presiding officer of the Standing Hearing Appellate Committee, AICTE, Government of India, who was also a member of the Azadi Ka Amrit Mahotsav Committee, and was also honored for her work with the Divyanga, with the Major Dhyan Chand Award for Best Star Yogasana Coach. Dr. Meena is much more than this, and this is only an official introduction, as you know, because she lives yoga, reads yoga, thinks yoga. And so with that brief introduction, over to you, Dr. Meena.
Thank you very much, sir, for those kind words of introduction. I would like to share my screen. Yes, is it?
Yeah, it's coming.
Is it visible?
It's visible, but not yet the full. Now it's full screen. Thank you.
Yeah. Is that okay? Yes. So namaste and vanakkam, everybody. Let me start with the Om chant. I humbly bow down to this Guru Parampara, the Rishi culture Ashtanga Yoga, my Guru, Dr. Randhaval Yogi sir, my mentors, Professor Sethuraman sir, because of whom we got this term introduced to us, and we understood the term salutogenesis and how it can, vibe with yoga therapy. So thank you, sir. And our dear mentor, Ananta Krishnan sir, we fondly call him AK sir. So thank you, AK sir, for putting us on in this track. So with not much ado, and Sobana ma'am was an excellent presentation. The screen is not moving. Yeah, the screen seemed stuck. So that is something, So after that wonderful elucidative presentation by Sobana ma'am, let me make an attempt to convince you all how salutogenesis and yoga therapy can come together, which is what we are doing here at the School of Yoga Therapy of ISCM. So this will be the topic that we would be discussing today. So what is yoga? This is a basic thing that yoga, the term has come from, derived from the Sanskrit root yuj. Yuj meaning to combine, to bring together, to integrate. So what is this integrating? The body, mind, emotions, the thought, word, and deed, the individual microcosm with that expanded universal macrocosm. So you do the practices, which is, like the experimental part, and you go through these practices, but the more interesting part is the experiential aspect of the practices, which is what, makes it the Anubhuti Shastra, and making you a more skillful person and a more sensible person with, the mental clarity, as we call, because all those disturbances of the mind is less. So why are we doing all this? So that we can promote health. So what is the definition of health as given by WHO? It is not the absence of disease, but a sense of well-being in the physical, mental, social, and spiritual levels, and all the levels of the human existence. And how does Aaron Antonovsky, the father of salutogenesis, elucidate this? It is like he agrees with the fact that it is again not the absence of disease, but what he says is that health is a continuum. So it is a continuum which keeps moving from a state of total ill health to a state of total health. So it is kind of the oscillation between these two. And when an individual is at ease with himself, we can say that it is that individual is very healthy. So when the ease, sense of ease, the sukha sthanam is lost, they end up having this ease. So it is again what we need to understand is that it is dynamic and it is not a state that you attain and then it remains. And the sense of coherence, as we have been hearing a lot about it, this helps determine the movement. Is it towards health or is it towards, the other end of the spectrum? And Ashtanga Yoga of Maharishi Patanjali. Maharishi Patanjali propounded this beautiful 8-limbed paths. Ashta means 8 and Anga means the limb. 8-limbed path, which we call as the Ashtanga Yoga. And they give us the guidelines as to how to live and make your life more meaningful and purposeful, which is in sync with the SOC, right? And gives us the tools also. It is not just explaining the purpose and the meaning, but how to attain that state with the tools given to us, and redirects our attention towards the health, which is very, very essential. How to stay that integrated being that we are supposed to be without, getting split apart, and so that the health and wellness can be promoted. So Ashtanga Yoga of Maharishi Patanjali is a classical work on yoga philosophy, which explains yoga as a way of life. So yoga is not just the 1 hour's practice that you do on the mat, you wind up the mat and then you just go your way. No, you have to live it 24/7 and throughout. These conceptual things, it is not a concept, but something that we need to imbibe and adapt so that it becomes a part of our lifestyle. And this, the Yoga Sutras, apart from the philosophy, apart from the experiential aspect, is strongly backed up by science. So all these put together helps to develop a holistic individual, from being that basic animal natured, reptilian natured human being, he is elevated into somebody who is human and then humane, and elevated up to the level where he can be one with that divine infinite. And it is not just for the development of an individual, but for the holistic development of a community also. So what are the 8 limbs that we have in Ashtanga Yoga? We have Yama Niyama, starting from Yama Niyama, Asana Pranayama, Pratyahara Dharana, and Dhyana and Samadhi. Yama Niyama, the foundation practices that make us, help us to control or curtail the animal qualities and make us more humane. So Yama and Niyama are responsible for our social health and well-being, because it teaches us how to, be a social being in this society. And Asana and Pranayama help us with the physical health and well-being. Pratyahara and Dharana promote the mental health and wellness. And Dhyana and Samadhi help us to understand that we are not just this gross aspect that is seen with the naked eye, but we are more expanded, as is the universe. So the spiritual health also matters. What is in that macrocosm is in us, the microcosm. So relating that to this, we become that holistic being that we are. So the next concept, is like the Pancha Koshas. Yoga, as given in the Taittiriya Upanishad, conceives man as not just, the gross level of existence as we can see, but with a multi-bodied and multi-dimensional universal being, consisting of 5 different levels of existence. The physical body being the gross level, as we can see, surrounded or internally also with the pranic level, the pranamaya kosha. So the basic annamaya kosha, the physical, physiological existence, pranamaya kosha, that is the level of prana, that is the vital body or the emotional body. The manomaya kosha, which is the lower sheath of the lower mind, which is generating all these thoughts, made up of the manas and chitta. And Vijnanamaya Kosha, Jnana, that sheet which helps us to discriminate, to analyze, is this required, is it not required? Can I do this? Should I not do this? Will this be good or will this hurt me or others? So the discriminatory factor, the viveka, the vairagya, all these are promoted with the Vijnanamaya Kosha, the higher superconscious mind, as we call it, made up of the buddhi and the ahamkara. And beyond all this, we realize that we are the universal being with this Anandamaya Kosha, as in, Dr. Ananda Balayogi, Ananda. Ananda itself means, pleasure, bliss, happiness. It's not just smiling. It's from internal, you are that bliss. But with all the little things, we kind of forget that we are, an individual is essentially a blissful being, but it is kind of warped because of the other things. So the cosmic egg, the protective egg, and that is the Anandamaya Kosha. And we need to understand that these koshas, they are not watertight compartments. Even Ashtanga yoga, it is not a separate 8 limb. We need to understand that it is all interconnected and interlinked, like the links of the chain. So the chain is as strong as the links are. So all of them are interacting and influencing each other, and they are not just different compartments. And what is the understanding of psychosomatic disorders or the stress disorders, the yogic understanding, as is understood? Adhija Vyadhi is the statement that's given, that's been given from previous our traditional text, where Adi means a small disturbance that starts with your mind. So as if you throw a stone into a clean surface of water, which is a quiet surface of water, what happens now? You have that ripple effect. So a small distraction or a disturbance in your mind creates a huge agitation, which is then percolated to the energy level. So the disturbing your breathing, disturbing your pranic activity in the nadis, which is again percolated into your physical level of existence, where the cellular activity is disturbed and ending up in vyadi or dis-ease. So what started in the Manomaya Kosha has now come down to the Annamaya Kosha, the physical existence. So where do we go back? We have to trace it right in the mind and uproot it right then, instead of letting it grow up to the physical level. So have you ever wondered, why some people are continuously ill, some are continually banging their heads on the kitchen cupboards and shelves and doors, or some keep putting their getting the fingers jammed in doors or drawers, or anything, or keep hitting their head in the door jamb up or the side. You can see the doorway there and you think you're walking straight, but as you're walking straight, what happens? You go and hit yourself. The door is not moving to hit you. You are going and hitting there. Like we normally say, the thorn, stuck me. It is not the thorn is searching for you, coming and, hurting you. You go there looking for it and then you get hurt, right? So why does all this? Some keep walking, not just up the stairs, down the stairs, or stumble. Even walking straight in a path which is very clear, but then they keep stumbling. So why does all this happen? We saw the Pancha Koshas and a mal-alignment, a disturbance in the alignment of these Pancha Koshas is the answer. That is being explained as the concept, very, very unique concept, very unique perspective, as elucidated by Swami Gitananda Giri Guru Maharaj, the propounder of Gitananda Yoga, the Rishi culture, Ashtanga Yoga Parampariya. He talks about this Nara. So the whole journey of yoga is about how to, make a being who is Nara with all these psychic disassociations, how to elevate that being and make him the Narayana that he is supposed to be, an integrated, divine, humane being that he is supposed to be. So that is the whole pathway all about. So the psychic disassociation. We all saw that the Anandamaya Kosha, the level of bliss, the cosmic egg, when that is perfectly centered with all the other lower bodies, then the state of samatvam or equilibrium exists, which is translated as homeostasis in the physical level of existence. And in the mind, it is translated as samabhava, where or the mental equipoise. So this is a perfectly aligned and an integrated being, all in a beautiful state of integration. But what happens when the physical body, the Annamaya Kosha, just slightly moves out of that alignment and is out of line with the higher bodies? You have the small or accidents, you can fall down, physical illness, all these are happening because of the slight out of line when the physical level, the Annamaya Kosha moves out. And if the vital body, the Pranamaya Kosha, is out of line, you have a lot of disturbances, the emotional or psychic distortions are seen. When the Manomaya Kosha, the lower body, the lower mind, body is out of line with its lower counterparts, mental issues occur. If the cosmic sheath is malaligned with the lower bodies, then untold tragedies occur. And suppose the other combination is like the Annamaya Kosha and Pranamaya Kosha are in harmony, but they are out of line with the higher bodies of the mind. So then the neurotic or psychotic tendencies develop. And the lower mind is in harmony with, the Manomaya Kosha, Pranamaya Kosha and Annamaya Kosha are, harmonious with each other, but they are out of line with the higher bodies. So then hatred and tormenting oneself is seen. So a perfect alignment represents well-being, which is facilitated and promoted by yoga. So enabling that person to attain that sukha sthanam is to bring back the malalignment through a few techniques in yoga. What Swamiji gives it as the loma viloma, or how to create that balance. Anuloma viloma prakriya, other jnana yoga kriyas are there, through which which are the tools to enable alignment to be promoted, so that he can become that integrated being again. So these are pictorial representations of how Nara can occur. You go and bang, looking at each other, but then you bang on each other. So there are different combinations as we were discussing. So we need to understand that the four lower bodies could go out of harmony, could go out of line, but the cosmic sheath, the Anandamaya Kosha, the cosmic egg is always the same, and it will never go out of line with its other lower counterparts, which says something, right, that we need to understand. So this is some, a rough correlation that I have attempted. I'm going to go from the right end to the left end. So the sense of coherence, as we all know, manageability, comprehensibility, and meaningfulness. So that could be promoted, the manageability could be promoted by the tools given in Ashtanga Yoga, the asana pranayama, which takes care of, which is correlated to the Annamaya Pranamaya, and that is the Stula Sharira, the physical level. And now comprehensibility, the ability to understand, the ability to stay content, that is developed with our right attitude, which is, the psychological training given through yama and niyama, or with the pratyahara and dharana. The higher mind comes up, where the senses, the outwardly moving senses are brought inward, and you start focusing on just one object or one thing inward. And the outward moving tendency of the individual, of the senses, is now not there. So you begin to understand what is the actual situation, and you begin to deal with it, which is correlated with the higher mind and the lower and the higher mind, the manomaya and the vijnanamaya, to the sukshma sharira, which is the subtle aspect. And now coming to the meaningfulness, the purpose of life, that is more, like I would correlate it with the spiritual nature, because we need to understand our dharma. What is our basic responsibility? So unless and until we understand that and we take it up, responsibility is not given to you. Somebody says, okay, you do this, and then you complete that task. That is not being responsible. You have to take it up. A small incident, I think I have the time. Yes. A small incident, like there was a factory where they were making shoes, and the owner was looking through the closed circuit that all of them were working very well. And then, at the end, in boxes, he saw that everybody were putting, each one is taking the cover, one is putting a shoe inside, one is doing something, packing, and then it is being put into the box. And then at the end, he sees that all the covers in the box has only one shoe in it. So he is like not understanding. So he went down. See, you're all doing your work so efficiently, but what is happening in the end output? There's only one shoe in each of the box. How is it going to be useful? And they all said, see, we are doing our job perfectly, but what can we do? The person who is supposed to be putting the other shoe is on leave today. So that's not our fault. So you understand how we take the responsibility. It is not the, how you respond to something. It's not an ability. You take it up willingly because it is your dharma, right? So that is more related to the Anandamaya Kosha and the subtlest of our existence, the causal existence, the Karana Sharira. So a few pointers as to how yoga is related to the whole concept of salutogenesis. We saw the main concept of salutogenesis, which is the SOC, the sense of coherence. And there are other, resources as given by, as explained by Aaron Antonovsky, the father of salutogenesis, the specific resistance resource and the generalized resistance resources. And both these have relevance to health promotion. So as you all know, we are living in this river of life, encountering the stressors, the trivial trials, tribulations, and it's like a turbulent life. But as we walk in this river of life, we have a backpack which is already with us. We are equipped with that, which is already available with us. These are the GRR, the generalized resources. So we walk the river of life with these resources. And as we walk this path through the river, we have the SRR, the other specific resistance resources available there in the river. All we need to do is look for it, search for it, the right thing at the right time, and apply it. So that depends on your coping skill, right? So that to relieve or to alleviate the current stress that you come across, and without that becoming a devastating thing. So it is all available all around you, everywhere. But all you need to do is focus and look for it and apply the right thing at the right place in the right time. That is the SRR. And what, determines this, it is via the, it is through the sense of coherence. So sense of coherence, how does that translate into a better health? So the GRR facilitates you to, approach the stressor and strengthens the SOC. So the pathway is like this. How do you cope up with the stressor? How do you strengthen the SOC? So with a strong SOC, that helps the SRR, the specific resource, to mobilize the other resources so that you will be able to cope and manage the stressors that you come across. So without that, it is not going to be possible. So if you don't apply that, what happens is that you fall down and it becomes a deficit, and you are taken to that other end of the spectrum. So you're not able to cope up with so many resources in hand. Still, you cannot understand how to do that, how to utilize that. You are not coping up properly. Your coping skills are not working. So you end up into that other end, ill health. So Antonovsky proposed this: a strong SOC allows one to reach out in any given situation and apply the resources that are appropriate to that stressor that happens at that moment. So I just hope that it's clear. And where does yoga come in now? Yoga is the practice that, like as Swami Geetanandagiri calls it, yoga practice may be called the arrow of the mind. So with a sharp mind, with a clear mind, you are able to reach the target. And the bow is the effort we put in. Like I said, it is an experimental practice, right? Yoga is an experimental practice to gain the experience. So that is the effort that we take is the bow. And what is our ultimate aim is to attain that state of samatvam, the sama, the state where you are in that equilibrium. So attaining that state of balance is what this is all about. And through yoga, which is our goal, which is we have the means, we have the path, we have the goal. All we need to do is apply this and then walk the path. So if, like in a yogi, the arrow is sent straight to the goal, then total health and well-being would be accomplished. And we have such beautiful concepts. Like I said, it is not conceptual. It is so many other things all put together. We have Ashtanga yoga, all those beautiful 8 limbs that have been given to us. So how does an individual, just to compile everything that we have seen and how to bring them together. So all these 8 limbs that we saw, how to apply that in your daily life. So how yama and niyama teaches us. Yama says all the pancha yama, that says ahimsa, satya, asteya, brahmacharya and aparigraha. All these 5 are the do nots. Do not harm others, not by thought, word or deed. So do not harm anybody, any living being. And satya, do not tell lies, but always speak the truth. And do not steal others' things or time, or be punctual. All these come under asteya. So again, do not steal. And what is that? Yeah, ahimsa, satya, asteya, brahmacharya. So do not go against the principles of nature. And aparigraha, do not be greedy. Be happy, be content with all that you have. So these are the basic, animal nature that we need to control, that we need to keep under check and not do it. So once we understand this, we can be elevated from that reptilian nature that a human being, the animal nature being, we can get elevated into that human nature, which is again promoted by all the niyamas, the pancha niyama, saucha, santosha, tapas, swadhyaya, ishvara, pranidhana. How to be pure. It's not just cleanliness, doesn't mean you put on the scent and you smell good. No, how to be clean, how to be pure, the purity of thoughts, everything matters. And saucha, santosha, the ananda, as we said, how to be that content, trupti, how to have that state, how to be that, how to be happy with little things in life. And tapa, how you can be disciplined with the austerity measures. Tapaswadhyaya, Can you analyze yourself? Can you understand your own mistakes? Can you correct them? Can you understand that? Because unless and until we analyze all that ourselves, we are not going to take it up from anybody else, because we go into the defense mode when somebody is pointing and telling our faults. So we go into that defense mode and start saying that no, this is not that, this is not this, justifying all our follies. So that is not what it is all about. We need to understand that and we need to correct it ourselves. And Ishwara Pranidhana. It's not just falling down at a feet. No, not falling down at the feet of the divine. You give over completely. Completely you surrender yourself by understanding that there are a few things which are beyond our understanding. So make me understand that. So give over and surrender to that divine being. And so asanas. So the third limb. Asanas are, this is very familiar to every one of you. Asanas, the psychophysiological practices, like sitting quiet is an asana. Sitting cross-legged is an asana. Anything, whatever you are, asi, be, just be. That is an asana. And pranayama, how does pranayama help you? By, gelling together all these Pancha Koshas. We are manipulating, we are regulating what is called the prana, what makes you what you are. It makes you alive. You are alive because of this prana. Once prana leaves your body, what happens? The doctor so-and-so, Mr. so-and-so, professor so-and-so, blah, 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 becomes the body. So that's it's of no value at all. So what is keeping you, whatever you are, is the prana intact. You are able to speak because of prana. All that you do, you see, all that you do is because of this prana. So how do we manipulate this prana, regulate this to be enabling to promote ourselves, enhance ourselves into whatever we are going through? Enhance and, the next step being prana, asana, pranayama, pratyahara. Pratyahara is, like I said, sensory withdrawal. Withdrawal of all these senses which have the tendency to move outwards and move inwards. And, start looking at your issues, your problems, and not just what is outside you. So you look for appreciation outside. You look for motivation outside. It's because you have still not understood that everything, the key to happiness, the key to anything and everything lies within. Like, Maharishi Patanjali says, Tatakshiyate prakasha varnam, as the benefit of doing pranayama. There's that inner light, which is like veiled with all these, negativities. So once we start going inside, you understand that light, which is going to be, which is going to guide you through, take you through your journey, which is the pathway that we are all, traveling in now. So pratyahara dharana helps you to focus at just one point, one place or one region, and then further dharana slowly slips into dhyana. It's like, you start pouring oil. What happens? Initially it falls in blobs, bluck, 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 and then it starts flowing continuously. So dharana becoming dhyana, the flow becomes continuous. The other example I can think about right now is the bird perching on a tree, but say, for example, an eagle perching on a treetop, and now it starts flying. So initially it has to flap its wings. So that is kind of like the preparatory. And once it attains that, level of height or whatever it is just gliding. So the gliding flow is dhyana. It has to happen. It just happens once you take it through. And samadhi, sama adi, you become one with that adi. Adi, the divine, the cosmic. So what we need to understand is what is in that cosmos is with the individual, as given to us by Sattai Mamuni. Andathil ullade pindathilum, pindathil ullade andathilum. So what is in the microcosm and macrocosm, it is all one and the same. It's just that we don't realize it. So that is the problem. Problem lies with us. And then we saw the concept of Pancha Koshas. So the Ashtanga yoga has taken you through this evolutionary path, elevated you into where you became one with the Adi, Sama Adi, that humane, the divine being that you are. And the Pancha Koshas, not again watertight compartments. These are, it's like a flow. It's like everything is integrated together in that perfect alignment. And we also saw with the concept of Nara, what happens when the alignment is lost, when it is distorted. So that was the concept of Nara as given by Swami Geetananda Giri. And how our journey, our pathway is to elevate us to become that Narayana that we are. I would like to conclude with always a take-home point, the point to ponder that makes us think. This is a small a story, right? So there was once a very, very poor boy who was searching, looking through, places, looking for every place where he can get some food. So he sighted a man who was an old man who was fishing. So he went and approached him. Can you give me one fish so that, I can cook it and get rid of my hunger? So this old experienced man just asked him a question. Do you want me to give 1 or 2 fishes that I, like I take now from the net? Or do you want me to teach you to fish, teach you fishing? And obviously what you need to choose. It's not just temporarily taking in hand 1 or 2 fishes. That's just momentary. What we are looking for in this path, in the path of salutogenesis, in the path of yoga, though difficult, like, in the Shreya Marga, the Preya Marga that we keep discussing about, it is not pleasant. It is very difficult to walk this path. It is full of thorns, and it is like, the river of life, the Sansara Sagara that we are crossing, that we are traveling. So we need to be equipped. So learn to fish. So learn to get empowered. And the empowerment of everybody, the individual who's lost the empowerment, who's not able to think for themselves, is what yoga therapy is all about. Empowering the other individuals. So teach them and let them experience, let them understand all this. And the yogic attitudes, with a clear mind, the clarity, mental clarity, the chitta prasadanam, and a proper attitude, the bhavana, pratipaksha bhavanam. How do we understand the other person's perspective? How do we perceive a problem? Like in SRR, we have all these, resources all around us. But how do we perceive it so that we can apply all these coping skills, perceive the problem right, to apply the proper solution at the appropriate time, with the help of viveka, the discriminatory factor, and dispassionate approach, vairagya. So with all this, I am sure we'll be able to travel this path, and we will be able to walk very, very well. So thank you so much. I'm stopping sharing. Thank you all so very much for the patient listening. And yes, I'm well ahead of time. We can have a few questions, and I'm sure our director, Anandubal Yogi sir, is going to help me answer them also. Sir, over to you.
Thank you, Dr. Meena, for that excellent presentation, giving us so many dimensions of yoga and relating it to salutogenic concepts. I especially love the attempt you made at coating the Pancha Kosha with the 3 aspects of sense of coherence. I think this is exactly what the other day Professor Ingan was suggesting, that we need to start looking at a bit more dimensions and how yoga can enhance the sense of coherence. Yoga can provide meaningfulness, purposefulness, comprehensibility, manageability. So your schematic of yama niyama, and then the asana pranayama is giving the manageability. I think it was a very beautiful perspective. Let us go over to our audience for any questions and pointers at this point. Anybody interested, you can just put your hand up and we can unmute you. We need to unmute. I've changed the muting settings.
May I speak, sir?
Yeah, so you should be able to unmute yourself. Yes.
May I speak, sir?
Yes, sir.
Yes, Ramareddy, sir.
Thank you, ma'am. Very nice presentation, both of you, madam. And especially, I had so many of your lectures, but today I got so many things in the form of examples, like the shoe example or the eagle example. So these things are very nice. And also about the progression from Yamanima to the ultimate Samadhi, you have explained so well. Here, for the sake of students, a little confusing thing I would like to clarify. Our Swamiji's concept is psychic disassociation. There is a concept in psychology called dissociation. A part of the personality splits off from the mainstream and starts functioning independently for some time, and the awareness about the secondary personality wouldn't be there with the principal personality. After some time, it merges back into this one. We are all familiar with our Anayan or Aparicitudu, and also about the Chandramukhi and the standard Dr. Jekyll and Hyde. So this type of things are dissociation things, double personalities and multiple personalities. One may get confused about this disassociation and dissociation, I thought of telling. And regarding the need for salutogenesis, a lot of need is there. And as both of you are telling about this one, recently, two phenomena I have noticed. One thing is a silver lining. Another thing is the darker aspect of it. Many of the medical students, especially the PG students, are committing suicides. Mostly happening these days, both in Telugu states and also in Tamil Nadu also. Even IIT students also committing suicide for trivial reasons. I think they require the foundation in the first year itself. That is the darker thing, and we need that one. The brighter thing is, last year, the person who got first rank in the PG entrance, the most coveted subject is radiology. Instead of taking radiology, he opted for social and preventive medicine. When the people asked why you are taking social and preventive medicine when there are so many lucrative clinical subjects, he said that I do not want to be remaining in the dark room. I would like to be with the people in the community and serving them. So that is the spirit of the new people. And I think that is the spirit which we, salutogenesis concept, would be helping. And already in the medical education, they started teaching social and preventive medicine from first year onwards. I think salutogenesis should be an important section in social and preventive medicine. Maybe it may be moved to ask for a separate subject for salutogenesis now at this juncture, but at least it should be an important part of social and preventive medicine, which should be taking care of the holistic health of the people. So I think we can start with the students and health professionals initially, so that it will be rewarding. I feel so, madam. Thank you very much.
Thank you very much, sir. We are indeed very, very blessed in this university, Sri Balaji Vidyapeeth, that everything is in under one umbrella, where we have the approach to medical students, the dental students, the nursing students, the allied health students, the students of pharmacy, the students of physiotherapy, and every student who joins here in the first year, they get an orientation with everything that is happening here. And there is a compulsory awareness program with yoga And a few of them have yoga as part of their curricular activity. Say, for example, there is 90 hours of yoga being given to the nursing students. And there is like, again, this is part of the elective in the allied health students. So they get prepared in that, the beginning stages, so that, again, bringing these two together, the specific resources that we have and how to understand, to utilize the skills that we have, the resources that we have, because yoga equips you to be, use those skills. That is, we are very, very blessed to be wherever we are, thanks to our chairman, Chancellor, Sri Rajagopalan sir, way back in 2010, when this was not even a term that was familiar to us. Way back then, he brought yoga therapy, music therapy in this hospital setting, the healthcare setting. And slowly, I'm sure it is like the understanding is becoming more and more, the awareness of what is right and what is not is becoming more. At least the students, like you were saying, the suicidal tendencies. So when we teach so many hours of yoga, they know the basic techniques through which, like when they are feeling stressed, you shake and throw it out, get it out of you immediately, sublimate it. Why carry it? Why let it burden? So all these little techniques we teach them. So it's not a very, very difficult thing for them to take just 5 minutes off. And I see people doing that, walking in the corridors, whenever they cross us, that is something which is the favorite here with the students. They always love to shake and throw. So when they are crossing us, they do this. So just
As Professor England was telling about this one, people talk a lot, people know a lot, but they don't practice it. The difference between the intellectual insight and emotional insight. Talking and that is the main obstacle regarding the practice of this one. I think, although they know about this one, really coming to the practice, I think we have to repeat it again and again, so that maybe after the nth time, I think we'll be succeeding well. And I am also very happy to be associated with the SPV as a scholar here, and very fortunate to know about these concepts.
thank you.
I was just thinking about this concept. In the past, now nearly 10, I'm on to my 10th year at SPV. And we have seen so many students who personally we have interacted with. And we know that the fact that they completed their training here and went out is only because at that time CITER or SIMTER existed. And I know so many of the students used to come here, and when they left, they would come with a chocolate and say, if it had not been for CITER, that's how they interacted with us at that time. So if it were not for CITER, I would not have continued the course. I would not be a doctor today if it had not been for the space you provided where I could just come and let go. So I think along with the techniques, because many times when yoga is introduced into educational system and in policy decision, we water it down to the techniques. So it is not only the techniques, it is the environment we create through the yoga abhyasa. So the environment should be one which is safe, secure, nourishing, supportive, compassionate, empathic. That environment is playing a major role for the young students. And I joke with them, if ever you feel tired and you need to sleep, don't sleep in class. Come here and lie down and say you're doing Shavasana. See, we will give you the support you need on those days. You need to recuperate rather than being harsh on the student. No, how can you sleep in class? Did you play video game the whole night? This is how we normally scold them in class when we find a student sleeping. I say, if you have that type of thing, if you feel stressed out, come here, go to the music department, do a drum circle, go bang some drums, listen to some music. You're going to feel better. And I cannot tell you how many students we have seen go through this process. So let us not think it is only the technique. The technique of yoga, the technique of music therapy is important. But the wholesomeness of the experience of yoga and music therapy shouldn't be lost. Because I have seen this happen even in yoga institutions where yoga has got watered down to just the technique. And the technique alone may not be enough. It's the whole experience of yoga that gives what we call yoga anubhava, the anubhava of yoga. As Meena rightly pointed out, yoga is an anubhuti shastra, an experiential science. So experiential means you have to do it, you have to practice it, you have to live it. And then these changes will happen. So thank you, Dr. Meena, for stimulating that and the beautiful point that came up out of it.
Sir, just one more bit. If anybody has questions, I'll take it, but otherwise I just wanted to say something. Can I? Yes, I think no, I don't see any questions, right? Any raised hands? No. Okay. So when we were talking about, improving or how to make the person skillful, how to enhance the coping skills, the abilities. Just a small example. We did a study with the children with autism spectrum disorder, wherein, they have a lot of the dental issues. So this is an interdepartmental study with the dental college and CITA, the School of Yoga Therapy. So what happened was that the dental issues, there were two groups with yoga, without yoga. So the coping skills, the brushing skills enhanced with the group that had yoga. The other group had only the audiovisual pedagogy. So, so what is yoga doing is that as an additional therapy, as an additional whatever is given, say for example, if it is a medicine, as an adjunct, if we are giving yoga, it is enhancing the ability, the skill, whatever it is, in whatever way. For example, my interaction with the special children, they are very, very dependent because of the tactile senses, or the eye-hand coordination is very low with them. So they cannot button their own t-shirts, or they cannot tie their, pajamas. So these little skills are not found in them. But with yoga, it's again an anecdotal experience that I'm sharing. How, yoga enhanced all these skills so that they are made independent. They are empowered so that they can, button their own shirts. They can tie their own pajamas, which is for us looking like something very, very trivial. But it is a huge achievement when we can, think about it from their side. So like this, I can just go on and on and on. But this is something which I just wanted to mention. Thank you. So is there any questions that we would like to take? Or yes, Prasida, I can see
I wanted to invite Prasida to make a few comments. You don't get her on the video too much.
Namaste and thank you very much. Both the presentations were lovely, and I've really enjoyed listening to Dr. Sobana, and as always to Dr. Meena. We can just get lost in whatever she says, we can just drown in that. Whatever, Dr. Meena has to offer is always, it gives, even if you are in yoga, it always gives you food for thought. So, and yes, like everybody has mentioned, you're trying to connect the Tri Sharira with the Pancha Kosha, with the Ashtanga, and with all the sense of coherence in salutogenesis. I think it again gives us food for thought as to how can we connect all these things as a model, the philosophical and the conceptual thing, and also how do we connect it to the practical aspects of our lives. So it appears a very simple chart, but then there is a lot more to think and a lot more to develop, I'm sure. And first of all, I'm so thankful for this webinar. And this has opened up a whole new area to think about and how to relate salutogenesis and yoga, and also yoga therapy. I feel the kind of work that is happening at ISCM, not just the research and other things that are going on, but the service aspect. I think that's something which it is like, again, a model in integrative medicine, and not just for the people who are coming them to get that service that it is offered to them, but all the people who are at SBV. I think the environment aspect that Dr. Ananda talked about, that's so beautiful. I feel that I think this is the way to go ahead. I hope this happens more in academia, wherein mental health becomes a big issue at times. And I really hope that this gets more propagated, not just the concept of salutogenesis and holistic health and how yoga can contribute, but the whole model of how this is all integrated. I mean, congratulations, and I really wish this just spreads more. And I'm so happy to be a part of all of you also, always. And thank you so much.
Now, I would like to share that we have got the necessary approval and are awaiting the official letter where we'll be having Prasida join us from the distance as an adjunct faculty for the School of Yoga Therapy. So thanks to the MOU with the Kaivaladama, we are looking at that. We'll also be having Dr. Hemant Bhargav from Nimhans on the team. And I know that Prasida and Hemant were together recently at Bangalore. And also we will have Dr. Jayaraman Mahadevan. So we have got the approval for 3 faculty in the School of Yoga Therapy. Of course, Dr. Sangeeta as adjunct faculty in the School of Music Therapy, continuation of our already existing people. And we are also, we have also got for Dr. Laurie Rubistin Fazio of LMU. So slowly it is happening. Now the next part is we are trying to build a team for salutogenesis also. And part of this webinar is building that team. We have Professor Ingan, our own Avishai will be joining us, and a few more on a team who will bring in the health aspect, and Rama Reddy sir will be invited to that also. So along with the 2 wings of yoga therapy, music therapy, one more which will focus on this coming together in salutogenesis. So I feel that we need also not a separate wing, but we need the joint between the 2. Through salutogenesis, we will create it. So looking forward to a lot of good stuff happening. So it's quite interesting. Some days you think time stops because we have not yet come to 12:30, and it seems like we have been going on and on and on and on. So I would like to thank all of you for joining us from different parts of the world, and officially thanking Dr. Sobana and Dr. Meena for the presentations today. And next week, we have 2 eminent speakers. We have on yoga and music therapies as a means of manifesting salutogenesis by our own Professor A.R. Srinivasan, who is the registrar of SBV, but as you know, is also an important faculty member in the School of Music Therapy. And a talk on the sense of coherence, GRR, SRR, that Meena had pointed out today by Professor Marguerite Daniel, who is a member of the Global Working Group on Salutogenesis, Department of Health Promotion and Development, University of Virgin in Norway. So we are looking forward to taking this forward with our resource persons over the next time. So make sure you join us. Don't forget to join us every Thursday. Be with us, and let's all grow and grow together in the spirit of salutogenesis with the blessings of our father of salutogenesis, Aaron Antonovsky. Please remember, it's a centenarial year. So we are celebrating that. Om Loka Samasta Sukhino Bhavantu Sarve Janaha Sukhino Bhavantu. Om Shantihi Shantihi Shantihi. Om. Thank you, everyone. See you next week.